Good morning, everyone, and welcome to the third conversation in our joint cancer conversation series between the Laura Crandall Brown Foundation, the Slive Foundation, and Forge Breast Cancer Survivor Center. I'm glad you carved out a little bit of time today to hear from Nick Dionne-Odom, who's going to be talking about the role of the co-survivor and walking alongside someone who has cancer. A couple of housekeeping items before we get started. If you'll just put yourself on mute so that we can give our full direction to Nick. And then also this is being recorded, but we will stop the recording at the end of his formal presentation so that we have a time for question and answer and people can feel like they can really ask those questions. If you think of something along the way, please feel free to put that in the chat and we'll get to it at the end, but of course, open it up formally then. Right now, I'm going to kick it over to my colleagues and we're going to share a little bit about who we are as organizations and then we'll get going. So first off, I am with Forge Breast Cancer Survivor Center. We are here in Birmingham. We are a breast cancer organization that works with men and women who have been diagnosed with breast cancer, as well as their family, friends, loved ones, anyone that is close to that person. And so our work really starts kind of at the day of diagnosis. We are fully focused on making sure that once someone has received that diagnosis, they feel supported through our organization as well. We do that through a number of different ways. But if you'd like to learn more, I encourage you to visit our website and it's forgeon.org. Thanks.
Hey everyone, my name is Taylor Gallops and I am from the Laura Crandall Brown Foundation. Our foundation works with women with GYN cancers and we are in a threefold mission of education, research, and direct patient support, whether it be through emotional support or through financial support. If there are any ladies on the call with GYN cancers and you do need support, please go to our website at www.thinkoflaura.org. And then you will find a way that you can click and seek help or to get involved with that. And we would love to help you in any way possible. Again, we're so thankful that you're here and I hope that we have a great conversation today.
Hi, I'm Emily Campaluto. I'm with the Slive Foundation for Prostate Cancer Research, and I am the Education and Outreach Director. We are a 5-year-old organization, and our mission is to fund both cutting-edge prostate cancer research grants, as well as raise awareness for early detection. We fund pilot grants, so everything looking at ways to improve detection, all the way to the quality of life course as a survivor. And we do a lot of screening opportunities in the community. We really encourage our men to get screened. 1 in 8 men will receive a prostate cancer diagnosis in their lifetime, and the first step to screening can be as easy as a blood test. So please visit MikeSliveFoundation.org to learn more. We're looking forward to today's talk. Thanks for being here.
Hello, everybody. One more introduction. My name is Elena with Forge Breast Cancer Survivor Center, and I have the privilege of introducing today's speaker. So that's Dr. Nick Dionne-Odom. He is an assistant professor in research in the UAB School of Nursing and an expert in family caregiving for adults with cancer. And lucky for us, he's actually on Forge's clinical advisory committee. As our organizations, have recognized individuals with prostate, GYN, and breast cancers throughout this fall, it feels very fitting to take a moment to also recognize the co-survivors and the caregivers who are alongside the journey of anyone who is experiencing a cancer diagnosis or is in a survivorship phase from cancer. So Nick, I just want to say thank you so much for sharing your time and talents with us. I'm going to stop screen sharing so that you can tee it up on your end.
Great, thank you so much. And I just really appreciate being invited here today and just really feel honored to be able to talk to you all. I'm not sure exactly who's in the audience, but my work has really focused on families supporting loved ones affected by serious illness, including prostate cancer. So it's really great to see you all. Hattie, it looks like you have your hand raised. Do you have a question or concern or want to make a comment? And I'll share my screen while in the meantime. All right. Well, Hattie, if you have a question, you might be able to type it into the chat. Not sure if you can hear me, but you can totally do that too. So I'll just go ahead and get started. So the focus of this talk is really about, something that you all likely have very intimate experience with, which is how do you cope when someone you care about, someone you're close to, has cancer and is living day to day with it. How do you navigate all of that, and how do you deal with it? As both being a very supportive partner to this person you care about and coping on your own. So I think it's probably good to start with this question: who is a co-survivor? And the American Cancer Society defines it as anyone who lends support to someone with cancer from diagnosis through treatment and beyond. So some of you may be family, some of you may be close friends. It can really be anyone who does help support someone from the time they're diagnosed through treatment and then perhaps beyond. And there's three things I really want to impress upon all of you today. First, as a co-survivor, I want you to know that you're incredibly invaluable and that you're not alone. Caring for someone with cancer can be a very isolating experience. And if there's anything to take away from today, it's that you're not the only one out there dealing with this. Two, that there are positive approaches to coping that can help you stay healthy. It is possible to be supportive of someone with cancer and actually thrive in that role, albeit it can be extraordinarily difficult. And three, to reach out for help when needed, even when the person's cancer has gone into remission, or when you're in that survivorship phase. That phase can still have a lot of difficulties along with it. And so it's important to know how to reach out for help when you need it. So let's start with this first big idea about how important you all are and how not alone you all are. The first thing to take away here is that if we look across the country, the number of folks providing support to someone with cancer is a lot of people. About every 5 years, the National Alliance for Caregiving conducts a national survey of caregiving in the US. And in 2016, they did a special report on their 2015 data, looking at the numbers of cancer caregivers in the US. So of the 40 million US adults who care for an adult due to disability or illness, that's about 1 in every 5 Americans. About 3 million provide care to a person with cancer. And so just so you know, that estimate is likely an underestimate, because on the survey, you could only select one condition that you provided care for. And many folks with cancer have more than one condition. And so that 2.8 million really is a pretty conservative estimate. But I don't really have 2.8 million of anything. So I sometimes have a hard time wrapping my head around how big of a number that is. So it's about 6,700 747s fully packed, or it's about the equivalent of 35 fully packed NFL-sized football stadiums. It's also about the size of Chicago. So if you could just imagine walking around a city like Chicago, and every single person you saw was caring for someone with cancer, and just kind of thought about that for a second. That's how many people are out there right now caring for someone with this. You're also invaluable, and that's because you're providing essential home and healthcare services to these folks. In fact, 3/4 of families perform medical and nursing tasks, performing the same tasks you would see a nurse or a social worker doing in a hospital setting. And they're doing things like managing and monitoring symptoms, managing medications, breathing treatments, relatively sophisticated ostomy and wound care, administering G-tube feedings, catheterizations. Many of you may have done these things for your loved one before. And it's the idea that caring for someone with a serious illness, it is not like it used to be. If we even went back 30 years ago, the level of complexity of care delivered by families in the current age is very different and way more complex than it ever has been in the past. And not only are you all doing a lot of these medical and nursing tasks, you're also performing many other day-to-day tasks to help support this person with cancer. I won't read through this list, but you can just see that there's an innumerable number of things that you all are doing to provide support to this person. And you might think, gosh, that is a ton of time. And if any audience knows this well enough, it is you all. The average family member provides about 8 hours per day of care over a period of about a year plus a few months. And so it's not that surprising, and some of you may relate to this, that being a family member doing this can be a serious threat to your health. In fact, on the best data that we have, about half are experiencing clinically high levels of anxiety. A third to a half are likely experiencing clinically high levels of depression. About 1 in 4 experiencing high financial strain. And about 15% may be experiencing very severe pre-loss grief, which tends to predict something that we call complicated grief and bereavement. And that's a kind of grief that is beyond the normal grieving process and tends to last beyond a period of years for many people and can be very debilitating. So while families are doing this work, they're unpaid, but their services are invaluable. In fact, it's been estimated that US family caregiving, conservatively estimated, is valued at about $522 billion per year. And I don't have that much. So I have a hard time also conceiving of how much $522 billion is. So if we look to the NIH, that is the National Institutes of Health, that is the governmental entity that supports all research related to healthcare in this country. And their annual budget is around about 40 billion. It's maybe a little higher now in 2021. Apple's 2015 revenue was about $220 billion or so. The country of Sweden, their entire GDP is around 500 billion. The entire Medicare budget, at least in 2014, was just over 500 billion. And so US family caregiving, all of the unpaid work that folks are doing, is valued at about just past these high ranges. So it's a very significant part of the entire national economy. It's a large workforce delivering a lot of unpaid care. So here's the take-home message for this first part. There's about 3 million family members performing a variety of essential and valuable tasks that can consume, basically be a full-time job over a period of years that can take a marked toll on their physical and mental health. Okay, so caregiving can be really hard. How can we think about positive approaches that can help you stay healthy? So I develop and test interventions to support families who are caring for patients with advanced cancer. And one of the first things we do with folks in our program is we just kind of step back for a second and we think about how does stress work? Like if we just break it down, like how does stress actually work? It all begins when we have a stressor in our life. So here's some examples, like juggling work and home, or providing transportation, watching someone you care about struggle with symptoms, talking with your loved one about the future and all the what ifs in the world. Now, for some people, these stressors might not seem like a big deal. For others, they're a huge threat. So it kind of depends on how you interpret these stressors. So you'll have thoughts and feelings about them. You might think, I can't cope with this, or how are we going to possibly pay for this? Or, oh my gosh, I just didn't sign up for this. I'm caring for this person. I don't really want to be in this role, but I feel like I've just been forced into it. And you can have feelings like worry, anxiousness, sadness, anger, guilt, frustration, fear, all very, very common feelings that one can have towards these various stressors. This can result in behaving differently, right? Different habits. You might start forgetting things. You might start ignoring or avoiding problems. People might have bad tempers, or they might start avoiding friends. They might start missing their own medical appointments. They might start drinking more, smoking more. They might start eating worse. I remember counseling a guy that gained over 15 pounds because he had to spend an hour commuting to take care of his mother, and all he could eat was fast food on the way there and back because he just didn't have time to cook anymore. So it can lead to these different habits and have a real impact on your health. This can then lead to physical symptoms. You might feel tired all the time, or you can't sleep. You have headaches, or you have a change in appetite. You might have more pain, or an upset stomach, difficult concentrating, have a lower sex drive. All of these physical symptoms resulting along this chain of reaction about how stress works. So I think it's good to just kind of step back for yourself, for each one of us, to just think about and articulate how these things might actually operate in our own lives and our own circumstances. So then you can ask, well, what kinds of stressors, what kinds of challenges have you faced as a family member of someone with cancer? Maybe it's personal relationships. Maybe it's been very difficult to find what is the meaning of all this in life? How do I possibly balance going to my full-time job and doing all of these other responsibilities? I'm really worried about what's going to happen in the future. Like, is this going to get worse? How do I possibly prepare for that? Money and finances. It can be very difficult. It's a lot of very difficult conversations that need to be had. Scheduling conflicts. Accepting the person's illness or physical limitations. This person may not be able to do what they used to do, and that can be very difficult. Staying personally healthy. How to have a positive attitude on a day-to-day basis with this. Just simply enjoying yourself. And then balancing this with all of your other responsibilities. They don't just go away. This has been added on top. And adjusting to life after caregiving. And that's one that I wanted to spend a little bit more time thinking about. Was this having everyone think? What's helped you adjust to life after caregiving? If you are, in fact, a co-survivor, if the person you care for, if their cancer is now in remission, it's quite the shift to going back sort of a post-cancer lifestyle. So what's helped you adjust? So some things that we tend to recommend that folks do is to reestablish relationships, reach out to family members, friends, coworkers that you may have fallen out of touch with while you were caring for your loved one, to resume hobbies that you might enjoy while acting as a caregiver. You may have been too busy to spend time or activities you enjoy, or you may have felt it was disrespectful to take time away from the person you cared for. So we often encourage people to join or rejoin an activity or a club, or dedicate some time to a new hobby that you might want to try. Many folks go back to work. If you've taken a leave of absence or left your job, you might consider returning. And staying busy actually might make it a little easier for you during an adjustment period. Really taking care of your body. The stress of caring for someone often leads some people to develop some bad habits, and these could include smoking or drinking or eating unhealthy foods. Focus on letting go of bad habits and making time to exercise, eat healthy, get enough sleep. And if you feel like you can't make some of these changes on your own, talk with maybe your doctor or some other counselor about how you might be helped getting back on track. We often talk about writing about your experiences in this role. Writing about the stresses and events in your life can provide a more private way to express your feelings, might allow you to look back at your journey and clarify maybe new goals that you have or what you might now be looking forward to. So there's a lot of emotions that one can experience as a family member of someone with cancer. Here's a list. I won't read them out loud. I will highlight that last one, though, that I think is really common and not discussed a whole lot about the survivorship period, very unique to that survivorship period, and that's that fear of reoccurrence. And here's a few things that I would suggest to help cope with the fear of recurrence. First, to recognize your emotions. Many people try to hide or ignore negative feelings like fear and anxiety, and ignoring them only allows them to strengthen and become more overwhelming, is what we typically see. It often helps to talk about your fears with a friend or a family member, maybe a counselor. You can try writing down your thoughts. What we have found is that talking and thinking about your concerns can help you explore the issues that really underlie these fears. Accept that being fearful is normal. Telling yourself not to worry or criticizing yourself for being afraid won't necessarily make these feelings go away. Accepting that you're going to experience some fear and focus on ways to manage the anxiety could be a better way to go. Being aware that your anxiety may temporarily increase at specific times. These may include, follow-up care appointments. The anniversary of a diagnosis is another very common one. We often encourage folks to not worry alone. Many cancer survivors find joining a support group to be very helpful. Support groups offer the chance to share feelings and talk out loud with other people about your fears, who can really understand you, like they've been through the same thing. And so they can be easier to relate to and share many of the same experiences, and also have sometimes some very good advice about how to cope. They also help you, exchange practical information and other suggestions. Find ways to manage stress. It'll help lower your overall level of anxiety. You can try different ways of reducing stress that work for you. This might be things like spending more time being social with family and friends, or focusing on hobbies and other activities that you particularly enjoy. Exercising is one that a lot of people talk about, or meditating, even simple things like taking a walk or enjoying a bath. All these little things. Be well informed about cancer reoccurrence. In general, a lot of cancers have a pretty predictable pattern of recurrence. However, no one can tell you exactly what will happen in the future. So, an oncologist or a doctor, someone familiar with your loved one's medical history, can give you information about the chance that cancer could recur. And they can also tell you what symptoms to look out for. And so knowing what to expect may help you stop worrying that every ache or pain means the cancer is returned. If you do experience a symptom that doesn't go away or gets worse, we would encourage you to talk with a healthcare professional. We always tell folks, please remember to take care of yourselves. I think one of the things that we see probably the most with families that we work with is they tend to neglect their own health and healthcare. And for some people, it's because they feel guilty that taking time for themselves is just being selfish or taking time away from caring for the patient. We try to reinforce that if you do not take care of yourself, you will be unable to take great care of this person who relies on your assistance. And finally, recognize when you may need more help. And this really leans into the next and final message, is to really reach out for help when you need it. So when should you reach out for help? Here's some signs when it could be really helpful to get a little bit more help. First, if you have worry or anxiety that gets in the way of your relationships and daily activities. I think it's fair to say that everyone has sort of a typical level of worry and anxiety throughout the day. I'm talking about a level of worry and anxiety that's actually getting in the way of your relationships in a way that maybe it hadn't before, or it's getting in the way of your daily activities in a way, or it's interfering with work and the ability to concentrate, perform tasks. If you're feeling very hopeless about the future, and this isn't so much like, a once in a while thing. This is if you're feeling really hopeless on sort of a day-to-day way, or in a way that you had never felt before. If you're having trouble sleeping or eating well, if you're just not able to sleep at night, if you're waking up at 2 a.m., 1 a.m., and you just can't stop your mind from just racing with worry, or you're just simply not eating well. Either you're eating a lot or you're not eating very much at all in a way that's very different from what your typical pattern is. If you're not participating in activities that you used to enjoy, you know, for many folks, they have things that they really just derive a lot of recharge from, whatever that may be. And if you just find yourself just not as interested or just not doing these activities as much, again, another sign that you might want some more help. If you have trouble concentrating or making decisions, if you feel like you have nothing to look forward to, and if you're being unusually forgetful. And it's interesting, one of the most common signs of a person who sort of has chronic depression is they have trouble remembering things. It's not dementia per se, but they're just not as able to retain information. They just start to be a little bit more forgetful than they used to be. So if you need help, what kinds of support are out there? So here's a few different kinds. There's counseling, there's peer support, there's telephone and email cancer helplines, and there's online communities. So let's walk through each of these a little bit. So first, there's counseling. So here's how counseling might help. First, counseling is a great way to learn ways to cope and to feel less overwhelmed and more in control. Counseling is great because it can be one-on-one, it can be private, and you can just work on your own individual concerns and challenges and help explore ways to cope. You can really have someone who will just listen to what the caregiving experience means to you. I find in the programs that we offer to families, when our coaches work with people, it's the only space that these families can actually talk about what it's been like for them and just them. It's a great way to help manage depression and anxiety. It's a great way to learn about how to manage a loved one's symptoms and side effects, to learn about effective communication, address relationship issues and financial concerns, and to explore options and get feedback on important decisions. We often tell our families, you should never feel alone when making decisions. Like making decisions, we feel with our own programs should be a very social thing, that you shouldn't feel like you have to make all these decisions on your own, that you should be able to have people that you can talk to as a sounding board to get some feedback on what you're thinking and what options are out there. Workplace issues and strategies. Counseling can help figure out what kind of workplace accommodations could be put in place. Learn how to help your loved one or family understand and cope. And finally, explore and resolve any sexual issues related to cancer. I have a colleague who her work focuses on this particular area, and it's just a not very discussed, but very meaningful area where couples can really struggle. And so I would say that if there are issues around intimacy that's changed a lot due to the cancer, to please ask and inquire with your doctor about how you could explore and help resolve some of these issues, because it can be a very big deal. So there's a variety of types of counseling. There's individual counseling. You can get one-on-one. There's couples or family counseling where you can go along with the person that you're caring for. There's actually group counseling where you can go sort of with a small group. So there's different types of counseling as well that I think it's important to know is out there. All right, peer support. So I think support groups are great. I think they're not for everyone. So I think it's just important to think about, is a support group the right thing for me? And here's some of the things you might want to ask yourself if you're thinking about a support group. Is it important for you to connect with others going through the same experience? There is no right answer here. It's important to know what the answer for you is, though. Do you need emotional support, information, education, or a combination of both? If you could use some emotional support or just help thinking about things out loud, support groups are great. Information and education, we often would highly recommend that folks get that information from their oncologist and their physician and clinician team. And that's not to say that what you hear in support groups isn't accurate. We would just say that we would recommend that all that information and education be passed through the individual's clinician team? Do you prefer sharing your experiences with a group in person? Or do you prefer an anonymous environment like an internet support group? It's different for different people. Some people kind of value their privacy. Others are very social and they appreciate being able to share their experiences with a group in person. And some people are sort of maybe in the middle, but they prefer a little bit more anonymity. And just so you know, there are quite a few internet support groups out there that that sort of thing can be honored. Telephone and email cancer helplines. There's a lot of these. Here are a few. I won't read through each one, but if you have a smartphone or you can take a picture of the slide, I'm also happy to share slides or copy and paste these into the chat. These are just a few. There are many. Certainly want to highlight the Mike Slive Foundation up here on the top left, but you can see there's a lot of different telephone and email cancer helplines that are out there. And this is honestly just a very tip of the iceberg selection. Depending on what the needs are, there's many. How about online communities for support? A lot of these as well. Here are a few. Again, if you have a smartphone or you have a camera, you can take a picture of the slide. But these are some of the bigger ones. Lots of Helping Hands has been around now for, I want to say almost 10 years, and as well as Caring Bridge, which can actually is a great way to coordinate help with a large family. But there's many different options for different ways to connect to an online community for support. We also have resources here at UAB. The go-to phone number for resources and support at our Comprehensive Cancer Center are here. And then we also have a supportive care clinic, and the number is also here. They can provide additional support with managing symptoms, coping, advanced care planning, things like that. So those are the numbers, and I'm happy to go back to these slides if people would like. And probably the most interesting part, I'd love to hear from you all and have a little group conversation, hear from folks, answer questions.